The different SSRIs, doses, and some specific nuances related to clinical practice. Let's start off with Citalopram, trade name Cipremil. There may be other trade names as well. An SSRI often prescribed for depression, for OCD, obsessive compulsive disorder, and anxiety disorders. Citalopram has a R and S enantiomer, with the R enantiomer having mild antihistaminergic properties. The usual dose of Citalopram is between 20 milligrams to 80 milligrams. In some cases, higher doses are prescribed in obsessive compulsive disorder. The half-life of Citalopram is 24 to 72 hours, 1 to 3 days. Citalopram is one of the SSRIs that significantly increases QTc interval. Therefore, above doses of 40 milligrams, it's important to carry out an ECG and closely monitor QTc prolongation. Next is Escitalopram, the S enantiomer of Citalopram. Escitalopram has a good efficacy and a good tolerability profile. The doses generally are between 10 milligrams up to a maximum of 40 milligrams. Doses of 40 milligrams and higher are usually used in obsessive compulsive disorder. Dose-dependent QTc prolongation is an issue, but it's not such a significant issue as compared to Citalopram. Nonetheless, at doses above 20 milligrams, generally I will carry out an ECG and monitor for QTc prolongation. Escitalopram does not have any significant CYP enzyme interactions. Next, Fluvoxamine, an SSRI but has additional sigma-1 binding properties. And this is postulated to have anti-anxiety, some mild antipsychotic properties, but also anti-inflammatory properties. Doses usually range between 100 milligrams to 300 milligrams. In OCD, higher doses may be used up to 400 milligrams per day. One of the biggest challenges with Fluvoxamine is its enzyme interactions. Fluvoxamine is a CYP1A2, CYP2C19, and CYP3A4 inhibitor, and therefore it can interact with a number of other medications to increase their levels. From a pharmacokinetic perspective, fluvoxamine is used along with clozapine to increase levels of clozapine because it's a CYP1A2 inhibitor. Similarly, fluvoxamine is contraindicated as a co-prescription with agomelatine because fluvoxamine can increase levels of agomelatine. Next, Fluoxetine, usually started at 20 milligrams and increased to a maximum dose of 60 milligrams. Higher doses can be used in OCD. There are two key nuances to fluoxetine prescribing. One, fluoxetine has a long half-life, 5 to 7 days. 95% of fluoxetine will be washed out when we multiply the half-life by 5. 95% of fluoxetine is out of the system by about 35 days. This is important because if we were to switch from fluoxetine to another agent, we've got to recognize that it takes approximately 35 days for fluoxetine to be completely out of the system whilst other agent is still present. For example, if I stop fluoxetine on day 1 and introduce another serotonergic agent and go up to the maximum dose within the next week, this could pose a risk for the patient because of the risk of the combination of fluoxetine present and the other agent at the maximum dose. On the other hand, there are some benefits to fluoxetine's long half-life. It has an inbuilt tapering mechanism and therefore has a reduced risk of withdrawal syndrome because there is a gradual tapering that occurs due to its long half-life. Secondly, fluoxetine also has 5-HT2C antagonism. This specific property in the initial phases of fluoxetine prescription can increase dopamine in the frontal cortex, therefore can be prescribed specifically to treat anhedonia or decreased cognition in the initial stages. Next, paroxetine. In addition to being an SSRI, also has mild anticholinergic properties and is a NAT inhibitor, therefore increases levels of noradrenaline. Paroxetine is considered to be more calming and sedating than other SSRIs. Paroxetine and fluoxetine, both of these are CYP2D6 inhibitors. So therefore, combining them with other agents that are metabolized by CYP2D6, say risperidone, it can increase the levels of risperidone, causing side effects. One of the biggest issues with paroxetine is its withdrawal syndrome propensity. Because of its anticholinergic effects, it can result in significant anticholinergic withdrawal as well. The dosing of paroxetine is from 20 to 60 milligrams per day. Next, sertraline, also known as Zoloft, has also some mild DAT inhibition and sigma-1 binding properties. It's usually prescribed between doses of 50 to 200 milligrams per day. Sertraline also inhibits CYP2D6, so can increase levels of tricyclic antidepressants and risperidone.